Allison. Hi, everybody. Um, I, Allison, thanks for sharing that about the host being able to read all Zoom messages, even if they're designated to a specific individual. I learned that and was like, oh, whoa, I hope I haven't messaged someone something that maybe wasn't the best thing to message someone. But it's an important lesson learned. So we're excited to be with you all on this Monday morning. I'm here. Again, my name is Lindsay Bishop Gilmore, pronouns she, her. I work at PSH. I'm a senior program manager, and I'm here with my lovely colleague, Jasmine. Do you want to introduce yourself?
Hi, good afternoon, everybody. Jasmine Lewis from CSH, Senior Program Manager, she, her pronouns.
Thanks, Jasmine. So we're excited to walk through a tool that CSH created a few years ago. It's a free budgeting tool that you can use. Perhaps some of you all have seen it, maybe opened it, and maybe it looked overwhelming and you decided to close it. But we're excited to kind of walk through it with you and talk about how do you kind of create a service budget for supportive housing tenants that really centers quality and that centers tenant outcomes as well. So just a moment about who we are at CSH. So CSH is a national nonprofit. We have a mission of advancing affordable housing services to really help people thrive. And for us, we envision kind of a just and equitable world where people are thriving, meaning they have a safe and affordable place to live, the community in which they belong. They feel like they belong in their community, and that they have the services and the wealth to sustain their housing as well. And we do this a few different ways. The first is training and education. So we do a lot of free trainings targeted at supportive housing providers through policy reform, working with state and local government partners around funding. Advocating for funding resources. And so just recently in Michigan, got our first kind of line item service funding for supportive housing, and worked really closely with MDHHS on that RFP and NOFA, and then kind of work with other partners as they develop kind of their guidance for projects as well. A lot of advocacy as well related to policy. The third is with consulting. Sometimes we work really closely in providing technical assistance to projects. And then the fourth piece is around lending. We can provide pre-development lending to supportive housing development projects as well. And so, I'm sorry if you can't tell, I'm a little bit under the weather, and so please forgive me if I pause, take a drink, or have an unfortunate cough at the wrong time. So we are just wanted to have you all introduce yourselves, which you already have done. But I am curious to hear in the chat kind of what made people show up today. What is it about supportive housing service budgets that made you want to come today? Are there burning questions that you have? Are there things that you specifically want to learn? What is it about today that made you want to show up? We'll pause a moment. You all to kind of drop some of those in. We really want to hear. So if you're a new grantee, awesome. So maybe you're a new grantee, you're going to be developing a new supportive housing project. That's awesome. Yeah, so keep dropping those in. I'm going to go over kind of what to expect over the next hour or so, and then I'll come back. So just keep dropping in kind of why you're coming here today. So we want to make this as interactive as possible. I think Jasmine and I both know that it's way more fun if we hear from you all. And so we're going to be using chat, and we're also going to be using a tool called Mentimeter. It's a website, so we'll direct you how to use that. But it's a way for you to share feedback that's anonymous, maybe something. We want you all to be able to share kind of whatever is on your mind. And sometimes I know sharing can, if your name is attached to it, can be a bit more difficult. So we wanted to create an anonymous way for you to share feedback. So everyone is muted, but if you have a question, feel free to raise your hand. Feel free to use any of the reactions tabs that are part of Zoom. And then I know this is really hard in the day and age in which we're working, but if at all possible, just minimize distractions. And just make sure that you are on mute at all times. And then lastly, just be open to learning and sharing. And then I'm just going to go back and look and see. I saw Michelle, you do supportive housing. You're always wanting to learn new things, ways to help those that you're serving. Awesome. Serving a new supportive housing project or developing a new project. Love that. Working with returning citizens. It's not a supportive housing project, but are looking for other best practices. Awesome. Thank you all for sharing. It's helpful for us to know kind of what brought you all here today. And with that, I'm going to turn it over to Jasmine.
Thank you so much, Lindsay. Yeah, I was looking at the chat as well, and I got a blank screen too, Lindsay. I'm not sure if it's animated. No worries. All right. So it's always very helpful for us to know who's in the room in the chat. As always, you folks are the experts. We're here just to try to help you be awesome in all the things that you do. Some of these things may seem like they are repeats, which is great. That means that you've been in one of our trainings before. And so we look forward to giving you new information, hearing your feedback and all the things alike. So what we'll do is we'll start off with what is supportive housing. It seems like we have a few folks in the chat that are very familiar with supportive housing. And so supportive housing really combines the thought of the housing unit itself, the affordable housing unit itself, with services that people who face some complex challenges really thrive with, right? And so they have challenges with stability, autonomy, and dignity. And so supportive housing affords them the opportunity to be live in their unit while still having the same decencies that we have as we move into units. We're going to kick off with our mentee. And so what you have to do is you're able to go to this link and or scan with your phone the mentee, I don't know, little situation over here.
You can scan the QR code with your phone.
QR code, there you go. The QR code with your phone, and then there's a code there. And so what'll happen is we'll switch over to the mentee just to see a little bit of what some of the responses are. But if your agency had the opportunity to apply for unrestricted funding in supportive housing, how would you use that money to improve the quality of services?
And so you can go to mentee.com and enter the code that's at the top of the screen as well. And it will take you to a page where you can enter responses.
If mentee gets too dicey, feel free to also drop that into the chat and I'll read that one aloud. But so if you had the opportunity to apply for unrestricted funds, like we love unrestricted funds, right? So if you got a bunch of it, what would you be able to do to improve, use the money for in order to improve the services? I know that there is quite a bit that we would use those services for, but I'd like to see what you folks. Increase staffing, housekeeping services. Are there others? If folks want to come off mute, to mentorship, more staff to monitor.
Jasmine, there's also a comment in the chat around hiring more case managers so the ratio is lowered and to be able to work closer with those that are served.
Increase case managers. So a lot of what we're looking at is around staffing, and increasing capacity. Okay. Paid peer support. Yep. All of this is really falling around staffing. Okay. Fully staffed sites. That's my favorite. A fully staffed site. Paid peer supports, mentorship, more staff, increased case management, household items. Household items is also a good one that folks usually don't have funds for. Okay. All right. Well, thank you so much for entertaining us with that one. If there are more, feel free to drop those into the chat. You can also continue to add to the mentee as we transition.
And you may want to keep the Menti up as well, because we will go back to there um, uh, as we keep going. Sorry,
Thanks.
Jasmine.
No, that's okay. Thank you so much. So CSH has observed supportive housing since our tenure of being around. And so the largest thing is there's a long history of supportive housing in Michigan. We have been doing it and doing it well for a while. And so with that history comes the implementation of coordinated entry. We all have a very understanding and commitment to housing first. We know that there is significant need for service funding. Lindsay mentioned in her intro that CSH has been working closely with MDHHS around their supportive housing pilot that they have rolling now, in which it is strictly for supportive housing funds. And so recognizing that supportive housing funding is limited, we've noticed there is a high staff to tenant ratio. So most of you folks really have hit the hammer on the nail around, if you had unrestricted funds, being able to add more tenants. Add more staff to be able to support those tenants. We've also noticed that there is a need for supportive housing tenants' voice. So having those opportunities for the tenant to give their observations, give their input. After all, they are the folks that are going to be living in these units. And so we want to make sure that we are intertwining their thoughts, needs, and desires while we are while they're in supportive housing. We also notice that there's a need to have stronger partnerships with healthcare. There's a lack of unified advocacy voice at the local and state level. And so Allison mentioned being able to be a part of MICA in the work that MICA is doing with their membership. There's a lack of us unified at the state and local level. So that could, state and local level. So that could be an opportunity to increase those advocacy voices. And then there's little to no capacity to focus on quality because we have so many tenants that are in our units and we don't have enough staff, and the implementation of coordinated entry and the commitment to housing first, all of those things intertwine in our programs that don't allow us to really dig and focus in capacity. The only measurements that are being required are those of HUD outcomes. Are there other things that you folks have observed about supportive housing in Michigan? Folks want to drop it in the chat if you want to come off of mute. Did we capture it all? We've been doing supportive housing in Michigan for quite some time, but I'm not sure if we captured everything that would constitute as observations.
Just to add, Jasmine, I think the thing that we hear over and over, and I'm curious if you will on here, is just how coordinated entry changed the population that's being housed in supportive housing, and that people have more complex needs, and that staffing ratios that maybe worked in the early 2000s maybe aren't working anymore. And so I think that's not Michigan specific. I think that's the case across the country. But those changes, I think with coordinated entry, what we've heard has had a great impact.
Other things that have elevated up, and not just a Michigan thing, is the actual housing stock, right? So it's even harder for us to find units to place folks in, let alone folks who have intense need, right? And so making sure that it's somewhere close on bus lines and making sure it's accessible. And so all of these things that embody what quality supportive housing says is, little to no focus just because of the capacity. So we hear you and we understand. We appreciate you folks getting on trainings like this one in order to close some of those gaps and just try to figure out what you can learn new and in regard to helping the tenants that you serve now. So we'll transfer over to another mentee. So how do you know that supportive services are making a positive impact on tenants? And so what are some ways that is the indicator that this is working well for tenants? They are being impacted by these services. They're receiving the services. They're not receiving the services. Why aren't they receiving the services? What are some of those impacts of services for supportive housing tenants?
And are there things that you all are currently measuring across your supportive housing tenants related to services? And you can go back to the previous mentee if you still have that open.
And also you can drop in the chat as well if mentee gets dicey for you. Collecting feedback. Lindsay, we might be on the wrong one.
Oh, no, this is.
Okay.
Yeah.
All right. Mine was, how do you know the services are making an impact? This one is, how do you measure the impact? Okay.
Oh, sorry. The question may be slightly different.
That's okay. I'm like, wait a minute. Sustained housing, shelter, self-sufficient matrix, collecting feedback, return, self-reported satisfaction.
I'm assuming the return is like return to homelessness, or that you're measuring kind of the people that are exiting supportive housing or maybe re-entering the homelessness system.
Near that property, that's a good one.
These are great.
These are great. Thanks, folks. I have also learned that tenants will tell their friends about the unit. They are willing to sit on supportive housing tenants councils and such. And so you're able to get surveys back from the council and those kind of ordeals as well. Track who's exiting to permanent housing versus homelessness. Perfect. Thank you so much. Okay. So we'll transition into the quality practices. So we talked about when we first, and then track increases of income. Thank you so much, Michelle. That's a good one as well. So we talked about how quality sometimes gets put on the back burner in regard to supportive housing. We've noticed in Michigan, it's just not enough time, not enough money, not enough, all of the things in order to think into quality. But if you think about quality, there's some really key ways that we can integrate quality, and we don't even recognize like those are measures of quality and supportive housing. And so you folks did in the last mentee how you are tracking those success of those clients. Some other ways that we can look at that is like tenants stay housed. Tenants are satisfied with the housing services and the housing itself. Tenants increase their income and employment. Tenants improve their physical and mental health, and tenants have social and community connection. All of these are real positive supportive housing outcomes. They could be gathered through a different couple of data sources. They can be gathered through surveys. They can be gathered through your HMIS data. If you folks are using other side data, I know some communities use Salesforce, those kind of things. So whatever you're collecting data in, you're able to grab these. And then also it's noted that these can be quantitative or qualitative in terms of the collection of those positive outcomes. And so some examples of some supportive housing project goals: tenants stay housed. There's an X number of tenants stay in permanent housing for at least a period of time. I know folks had used that example before in regard to tenants staying housed. And then they improve their physical and mental health. So tenants with mental health challenges report progress towards recovery since entering supportive housing. Tenants strongly agree, staff helped me to obtain information I need so that I could take charge of managing my illness. And then tenants without health insurance were enrolled in health insurance. So these are some type of ways to gauge the improvement of tenants' physical and mental health. Some other project goals would be that the tenants increase their income and their employment. So there's a number of tenants that express a desire to work and are employed within a period of time. There's a number of tenants who enter housing with zero income and eligible for SSI and SSDI and will be connected with supports to apply. Tenants are satisfied with housing services. There are tenants have social connections. And so I told you folks when we started out, you're some of the experts in the room. A lot of these things are things that you guys are already collecting. So we don't think that we're doing like 100% quality. There are pieces of your projects that are doing quality. So kudos to you folks in the room for recognizing some of those project goals beyond like those HUDs, measure standards, and being able to recognize that tenants have different ways to show their satisfaction with the projects. One thing, I'm sorry, Lindsay, go ahead.
Sorry, I'm just going to add, I think the other part why we're sharing the outcomes also is that we know that it has a budgetary impact. It takes time to track and measure these things. And how do you budget for that time in order to measure these things? Because you may have to track across multiple kind of data systems. If you're using HMIS to track housing stability and you're using another tool where you're doing a tenant survey that's measuring some of these more tenant feedback things around happiness with or satisfaction with housing and services. And so being able to track outcomes in a really quality way also requires kind of the staff time and capacity to do that. Sorry, Jess.
That's okay. Thank you so much. And so as always, we want to parse out all of the goal data by race. Why do folks think that that's important? You can drop it in the chat or you can come off mute. Are there special ways or are there special reasons rather that we should parse the goal data out by race? Check the chat. Why do we think that this one's important? So as folks are thinking about it and dropping it into the chat, we want to be able to really see where the satisfaction lies, where the increase in income is, where the pieces of data lie around race, so that we can understand where the services are actually going and who's appreciating those services, who's not appreciating those services. Identify and yep, that's a good one, April. Thank you so much. Identify the outcomes. Yep, all of those things are great. Are there other reasons why we would want to look at to ensure equity in our services across the race? Thank you so much.
An example of an outcome that I was looking at with a provider, which was over a year ago, regarding housing stability, one of the things that they tracked was how long it took from referral to actually move in. Did it take for households? And when they broke the data out by race, it was drastically different. And that led to a lot of conversations around why might that be? What are things that are within that agency's control, not within their control? And so I think by looking at it, it allowed for greater depth of conversation among staff as well.
So we'll go into another Minty question here. Is your organization, excuse me, what role do you play in developing the services budget in support of housing? So are you the initial planner? Are you the implementator after the planning? Are you a little bit of both? where does your current role that you sit in play in developing the service budget? All right, I like that. Create, implement, and everything else. Are there others? Implementation, okay. CLC staff ensuring budget aligned with community priorities and goals. All of the above. Maintain the budget.
Another example that I've heard from folks is maybe you're not the creator, but someone else within your organization creates it and then gives it to you for feedback or input.
Checking the chat to make sure folks didn't drop anything in there. Okay. See anything in the chat. Okay. Thank you guys for that. So really when we're thinking about the service budget and what should be thought around in the service budget, whether you're the creator, the implementator, or all of the above, we want to start with the service plan and the tenant's needs, not where's the money, right? It is so easy for us to think about the money first because we know that's what makes the organization go around, right? But if we start with the services plans and the tenant needs, it's better. It's a way that you're able to align those needs of the tenant as well as the service to find the money that'll adjacent to it, right? So, for example, if there were there was the tenants had a need for childcare, and so where your current budget doesn't create space for childcare because everything is very restrictive, there is an opportunity to be flexible in other funding sources that would allow for childcare, right? And so maybe there's something that's a private fund. And so it gives you the opportunity to look at what your needs are and seek after money for that instead of looking at a blanket everything in order to like close gaps. There's no set formula for design and funding. It really depends on the service plan. And so when we say start with the service plan really is going to embody everything that your project is supposed to be, it has all of the requirements. Anyone can pick that document up and be able to see the front and back of your supportive housing project. And so that's where a lot of the meat and potatoes are there in terms of what is a part of the service budget. And then what will impact your service budget. And so we want to make sure that we're digging into each one of these as we are creating budgets and such. So I said in the beginning that we have been around supportive housing projects in Michigan for quite some time. And so there is a traditional approach that will start with the funding and the grant that's available and build a budget around what's available, right? Versus starting with the population, their needs, their wants, and then build high quality budget, best practices, tenant outcomes, and then seek out funding to support that budget item. So in the last example, it was understanding like what your tenants need and not attempting to force your budget to close those needs, because the bottom line is that all restricted funding, especially our government funding, will not allow for us to do some of the creative things that make our program stand out, right? So some programs are able to do furniture and some able to do household goods and some are able to do childcare. Like those are things that were identified as a need for the community and then implemented around finding funding around it. So I am going to encourage folks to really look at the target population and their needs as you create budgets of today. So some of the basics to our service budget is that the plan will will inform the service budget. Service budgets are separate from housing operation budgets. And then projected expenses should match projected revenues, right? And so most funding sources will require a clear separation of the services and the operating budget. And so making sure that we separate those will give us leverage in order to ask for what is, what actually we need, and be able to seek other funding for other things that we don't have. And so in developments, the sources sometimes would use a match. And so services budgets can be a bit tight when they first come out. And so you begin to think about partnership opportunities where services follow the tenant, and that the COC funded vouchers, and then you can look at different Medicaids and different eligible services, et cetera, et cetera. And so understanding that there are ways to close those gaps that are not always your housing operation budget or your services budget. There are means to be able to support the tenant with other resources that are also in the community. And so two major components of budgets are the expenses and the revenues, right? And so the expenses are personnel, other personnel expenses, direct services. And then your revenues turn out to be your grants, your contracts, your donations, your in-kind resources, those volunteer donated classes, work, any of those such, all of those are considered your revenue. So we're going to talk about some things that don't belong in your supportive housing budget. What is a service cost versus an operational cost? So we would only include costs related to the provision of supported services in the service budget. There's an operating management should be in the operating budget, front desk staff, utilities for the PS building, maintenance. All of those things are included into your operations budget. And then the tenant rent should be included in the services budget. How services flow. And so funding is generally tied directly to specific services, utilization of specific service strategies, or model and addressing the needs of a specific population. And so funding is really going to be tied to providing tenants the services, and it usually is a condition of your service, a condition of your grants. And so addressing the needs of specific populations, most commonly service funding is tied to services being provided at a specific location, specific population. And then utilization of the services, some funding sources are there to incentivize the use of specific strategies or models. And so this model could be used in order to receive funding.
Thanks, Jasmine. Thanks, Jasmine. I'm going to jump into the budget tool, but I want to go back. I totally made a mistake on one of the slides, and so want to make sure that I correct that. This last bullet on this slide should say that tenant rent should not be included in the service budget, and I'll explain a little bit more about why as I open the tool, but I just wanted to make that correction. I clearly, when making the slide, did not look at that closely enough, but wanted to make that known. Okay, so I'm going to walk through kind of the tool that's been created. And for those of you all that have maybe been in one of our previous webinars, we've had this tool for a couple of years. And we're on our kind of third update that just occurred most recently. And we initially created kind of this staffing and budget tool because we had a lot of funders and supportive housing providers coming to us and saying, we feel like we're serving a more vulnerable population. We need more service resources. How do we know if we're staffed at the appropriate levels? And so we created this tool to really help get at some of those questions, and really help to identify and help create kind of what is the best case scenario budget. And so it's not about what does one funder want to see, But as at an overall level, what does our budget look like? And it may be that it's funded through a number of service funding sources, but what is our kind of dream best case scenario budget? And so when that unrestricted funding request does become available, fingers crossed, that as an agency, you're kind of prepared to respond when those opportunities become available. And so we'll drop the link to the chat in the chat to this. But the tool comes with kind of the actual tool, which is an Excel document, a user guide. The user guide is fairly long, but very, very helpful, kind of understanding the nuances of the tool. And then resources on 4 different staffing models that we're going to go over at a very high level. And again, the tool is completely free. The Excel document is completely unlocked. And so while it has formulas built in it, you are welcome to change those. We don't recommend that you do, but it's a completely unlocked tool. So the way that it works and the way that we kind of designed it to work is that as a supportive housing agency, you're starting with kind of what your staffing model is. And so what is the approach, the model that is guiding how we're going to be delivering services? Is it assertive community treatment? Is it intensive case management? Is it tenancy support? What is the service model that we're using? Kind of what is the research that our service approach is based on? And then identifying, are the tenants new to supportive housing? And so is it an existing project where people have been living in supportive housing for a while and maybe already stable? Or is it a brand new project where people are going to be moving in a year or 2 years from now? The target population that Jasmine talked about, the number of units the tenant serves. And so you're going to want to know kind of how many units are you going to have? And you can do this by project, or you can do it as like an entire agency portfolio. So if your agency maybe has 3 different projects, you could kind of do it for one project, or you could combine kind of all 3. Just make sure that you're using kind of that consistent unit number. And then the other kind of piece that you're going to need is staffing salaries and any sort of HR assumptions that you use when you're working and creating kind of budgets. And so all of the things that are on the kind of left-hand side of the screen are the things that you'll need in order to kind of use the template to its fullest. And then when you enter that information in, what comes out is recommended staffing and caseload recommendations. And so based on the number of tenants that you're going to be serving and the target population of the model, we recommend X number of staffing, X number of supervisors, X number of peer support specialists. It builds out a multi-year service budget. And so it factors in like year 1 of the service budget, but it also can build in kind of a startup or ramp up. And so if you're a new project, we all know that we're not going to hire case management staff on kind of day 1 of the project opening, but you may want to hire people 6 months before because you need to train them. You need to get policies and procedures in place, all sorts of things. And so kind of planning for that ramp up as well, the startup budget. And then it builds out a 3-year budget based on the best kind of inflation data that we have of the day, recognizing that inflation at the moment is just a bit out of control, but it does work to build out a 3-year budget. So you can kind of understand for your agency, here's what we're looking at now versus here's what we're looking at in 3 years. And then the tool has a number of things that are specific if you are billing Medicaid. We're going to share kind of if you're not billing Medicaid, only because you need to be able to complete the budget as a budget before you even think about billing Medicaid, because there are questions that you need to answer before you can even think about billing Medicaid for supportive housing. But what it does generate a service unit cost at the per tenant, per day, per month, per year, which can be really helpful when you're going and talking with public and private funders of here's how much it costs to provide services at its kind of highest quality level. And then it calculates the net cost or the net between after the cost and revenue. And so hopefully you're operating in black, but it will help you calculate that as well. And so we wanted to share this to provide a little bit of context, and then the staffing models that we have included within the budget are these four. And we have pulled together also on our website available for folks kind of research based on these four staffing models, examples from other kind of places and communities to help kind of guide your agency. And so we've had providers ask for materials about the specific service model to help inform their board or such. And so we wanted to make those available as well. So with that, I'm going to jump into the tool. So let me drop this in. This is the link that, oh, I see that someone dropped it in. Lizzie dropped it in. Thanks, Lizzie. Here's the link. And I don't recommend pulling it up at this moment, just because it's a lot. And so I would recommend pulling it up after we're done today. But so you can download the tool, which is an Excel document. And then there's a little bit of guidance about downloading the tool and making sure that that you can edit it. There's a user guide that's really helpful. And then down below, for each of the service model types, there's an additional resources that kind of speaks at each that provides, I'll open, oh, I have one open, that provides a little bit more information around the service models, just to give you a sense, a little bit more information, and then access to some of the resources at a glance, or research at a glance as well. And then this is kind of what the user guide looks like as well. All right, so let me open the Excel document. Can folks see my screen? I hope not.
Yes, we can see it.
Thank you, Jasmine. Okay. Okay, so this is the service budget tool. When you open it, there are a number of tabs at the bottom. There are 9 tabs now. I think when we started, there were maybe 6. And so as with every new change, we have the tab. And there's also links here that you can access as well. And so the way that it's organized is based on kind of the color of boxes. And because the spreadsheet is not locked, the color of the boxes are really important. So if you see a blue box, it is recommended that these be changed or numbers be added in based on your unit count, target population, and such. The green boxes you should not change because there are formulas in there, but you can go in and change that formula. But if you change the green box, just know that it's going to impact the formula. And then the peach boxes are boxes that are based on a calculation that uses best practices. An example of an assumption that we use is that for one kind of supervisor is managing a team of 8 staff, and that supervisor is not managing kind of their own caseload of tenants, but that they're really supporting those 8 staff members. And so you can change that, but just know that it's based on a best practice. And so if you were to complete all of the tabs from tab 4 to 7, so these blue tabs here at the bottom that are labeled ACT, intensive case management, tenancy support services, and critical time intervention, it would create a budget summary that would allow you to compare the cost based on your tenant count, based on kind of the type of project that it is, It would allow you to compare the cost across the different models. Surprise, surprise. I don't think it's a surprise, but ACT is definitely probably the most expensive model that we see across all of the different service budgets. But this is nice because it allows you to see kind of what are the startup costs, what's the annual budget, how much does it cost per unit, and then per tenant, per month, and per year. And then it also will summarize the kind of revenue. So what are your sources of funding based on the budget as well? So tab 3 highlights some of the basic input and assumptions that you will need to answer and respond to help you develop your budget. And so some of these are yes or no questions that you're going to be answering. And so is this a new supportive housing project or program? So yes or no. You're just going to select those. And by selecting yes or no, it's going to impact some of the assumptions that are going to be created for the project. Do you want to include general startup cost in the budget? Yes or no? Do you want to include Medicaid provider cost in your budget? And so there's a whole separate Medicaid provider tab at the bottom. I think it's number 9. That will walk through, if you are billing Medicaid, all of the cost that's going to be associated to being a Medicaid kind of biller, or all the costs that you should be thinking about. It's not all the cost, but the cost that you should be thinking about and budgeting for them. And then you can decide if you want to create a budget for all of the different models, or if you just want to look at one. We're going to dig into the tenancy support and service coordination budget a bit more. And then below here, starting at line 15, is just some assumptions that we've based the budgets on. So the administrative indirect rate is at 10-15%. We know that that doesn't align necessarily with all funding sources like the HUD COC funding sources or others, but also recognize that administrative costs are typically higher than what those sources will cover. And so we've set it at 15% just based on kind of what we've learned in engaging with providers. And then added in some kind of mileage assumptions. The inflation rate is now set at 5%. The trainings and professional budget. So one of the things that we build into the budget is staff training. And so that is based on 1.5% of your salary cost. So it's this that you're always kind of building that in into your service budget. So that's an assumption that we use. Best practice is anywhere between 1 to 3% of your staff salary costs. And so we went with 1.5 here. And then employee fringe benefits. And so these are things that you can change. And then this is where the target population, the service model, and if it's a scattered or single site project really kind of impacts the budget. So for each of the service models, there is a staff person to supportive housing tenant ratio. And this ratio is for kind of the case management staff that will be engaging with tenants. And so you will see I'll just use the tenancy support caseload as an example. For individuals, if it's a scattered site project that's new, your ratio would be 1 to 15, so 1 staff person to 15 tenants. If it's a single site, it's 1 to 20. And then if it's an existing program, it's 1 to 20 as well. And then, again, I mentioned the supervisor to supervisee ratio being 1 to 8, and that supervisor is really focused on providing supports to tenants. If they are managing a caseload, it's maybe when there's staff vacancies, they have staff that are out, but they're really supporting people. And then a few other different kind of program assumptions that are built into here as well. So I want to share one of the tabs for one of the service models, so you can get idea of what that looks like, or what that would look like if you were completing it. So the first part, so I just clicked at the bottom on tab 6, which is the Tenancy Support Services tab. The first would be selecting your target population. So are you serving individuals? Are you serving kind of families with children? When families is families with children under the age of 18. And so you can select any one of these. You have to select one. You can't select multiples, but do best what you know based on whatever you know. So if you don't know the number of people with dual diagnosis, just go with individuals or families, but just base it roughly on what you know, and as a starting point. And then you would enter the number of tenants that you have scattered site. And so I'm just going to enter 20. And then the number of tenants that are single site. And so I am going to enter 50 just to give us something to practice with. And earlier on the input tab 3, I had selected that this was a new project, so it's going to build this out as if it was a new project. So below, based on the service model, so we are in tenancy support services, and the number of tenants, if it's scattered or single site, it will generate in red over here what our recommendations are. And these recommendations will then also come over here into these peach ones as well. The column E under annual salary, if you have for your staff what your salary is, I recommend putting that in here. This is totally based on a national average since it's a national tool. So if you are able to get that data for your agency, very much recommend it. And then for the time being, just ignore this billing and non-billing staff for the moment. Because this is the billing versus non-billing is Medicaid specific. So the recommendation is that for these total number of tenants, which if I can add is 70, that there would be 4 tenancy support service coordinators. And so that's, for lack of a better word, kind of case management staff. 3 peer support specialists. We typically recommend between kind of 1 peer support specialist for 25 tenants. And so that's how we got to 3 here. And then that gets at kind of a total of 7 staff there. And then in addition to your staff that are going to be, working with tenants day in and day out, you have the support staff, the administrative staff that are supporting the project. And I will say that this, from my experience in talking with projects across Michigan, looks vastly different across organizations. So you may have a program director that is overseeing, maybe they are overseeing a number of housing programs. Maybe your agency has rapid rehousing, or you have a shelter or something, and you have a program director that's overseeing all of them. A percentage of that position should be included in the service budget as well. It may not be the full FTE. And so maybe it's, 0.5 FTE would be added into this line item. And then we've also included administrative support. And I've heard quite a bit that that's not something that's always even factored into service budgets, but I think we all know that it's something that's terribly needed. And so again, how do we plan for kind of what we want and what we would like to see as much as possible? And then the supervision piece as well. How many supervisors for 7 staff person do you want? And so we had a recommended of 1 FTE. It's 7 total kind of staff that are providing services. And so maybe a little less than 1, but we're recommending 1 here. This housing manager position is a position that is working with the landlords. So since this project has scattered site, it's a staff person within the service agency that's kind of coordinating with the landlords. They may be doing landlord outreach. They may be the one that the landlord is coming to if there are challenges with specific tenants, or maybe when rent hasn't been paid. And this can be a role that is built in as well. We have not currently built a recommendation around it because it varies so widely. But we did add it because it's something that we've seen quite a bit. And then kind of this 2B section, unless you're planning to be reimbursed by Medicaid, for the time being, you can ignore it. Because it goes into kind of what is your productivity level, how many clients are you seeing on a day, what is your reimbursement type, is it set at different types of reimbursement levels. And so if you think you are going to be billing Medicaid, it's something that you already have experiences with, we're happy to talk through this a bit more as well as you're completing that budget. So based on everything that you complete above, it creates a 1-year budget below, so the start of a budget. So it takes your salaries, your benefits, and then it develops the staff training development budget that's based on 1.5% of the wages and salary. And so this is the personnel expenses that is included here. Some of the other personnel expenses that I've seen that may be under contracted personnel is if you are working with an entity that's providing services that you're paying for as an agency, but you're contracting with them. So one that I heard of recently was someone that was coming in and doing art therapy, had a small kind of reimbursement rate. The agency reimbursed them. If there are other partners in which you're contracting for their services as well, you would factor that in here. I've seen other personnel expenses such as data evaluation people, quality improvement people, that are in addition to kind of the staff that are listed above. And so you could add those costs here as well. And then there's the operating expenses. And so you're going to see things like rent, utilities, insurance, housekeeping. And this is only if you have to pay for the space that your services are being provided out of. This is not tenant rent and tenant utilities. This is solely if you as an agency are paying rent to someone for the space that your services take up. And so, and I've heard a lot of people say, well, yeah, we do pay rent, but we've never seen that as part of our services budget. And so this will give you an understanding of like literally how much does it cost to provide services, even the space that you're taking up. And so this is office supplies, computers, phones, all of those things, mileage, vehicle insurance. There's other client transportation, so Lyft, Uber, bus passes. The building renovations is only for your services staff space. It's not related to tenants. Those are things that would appear in a capital or operating budget. The furnishing would be for staff, so staff chairs, desk, copy, HMIS license, those sorts of things. And then minor household equipment. And so this would look a new project that just opened recently that I was chatting with. They have a very small room that makes available kind of food items that if there is a tenant that doesn't have food available, if people don't have laundry detergent available. And so they have a small budget that allows them to provide some of those things that are available to tenants as well. And then the miscellaneous expenses could be if there are tenant supplies, if you have a tenant council and you are identifying resources that tenant council can utilize to whatever that may be or whatever they may decide, you would factor that into here. And then, having focus groups including compensation for people with lived experience. If you're doing tenant feedback surveys, are there ways to compensate people? Are there ways to provide people with compensation for completing surveys or focus groups? So that's the operations part of it, of the budget. And it takes the personnel, the operating expenses, and puts it all into one lovely little budget down here below. So you'll get a sense of, okay, what is our total annual kind of program cost? And then you have listed below, and here are the how we're going to pay for this. Here are the resources that we can provide. I think there's a question, but I can't see it. Allison, is there a question?
It's me. This is Michelle Brinkman. I'm finding this very valuable, but I also I'm double booked today.
Oh.
So I just was asking how long this goes and if we can get a copy of the recording.
You can absolutely get a copy of the recording, and Michelle, we will also be sharing the tool, and I'm happy to sit down with you one-on-one. We're making that available for people as well, if that's helpful.
Thank you.
All right, I'm gonna just really quickly go through a couple of other things, and then oh, and Allison said it'll be on the YouTube page. And so this thanks, Allison. I thought, I was like, it goes to 2:30, but then I panicked and was like, oh my God, maybe I got it. So we will go a few minutes longer, and then we'll have lots of times for questions. And so the revenue, as you'll see, is actually the smallest part of the budget, because it's really just looking at what is your sources, and then how much are those sources contributing to the overall budget. And we acknowledge and understand that that some revenue will only cover certain portions of the budget. So Medicaid is a great example. They will only cover certain services, certain tenants. And so this is not meant to outline kind of what each revenue source is going to be paying for, what your COC grant is going to be paying for, but really to get a sense of what is it going to cost overall, and what staff do you need in order to do the work. And then to the right over here, it builds out a 3-year budget. And this is, again, just to give you a sense of what it's going to cost over time. So you'll see columns K, L, and M have kind of over 3 years. What does that cost look like? And then columns H and I are pulled from tab 8 and 9. And so that includes the general startup for the project, and then if there are Medicaid provider costs as well. And so the general startup, I'm going to go to a different tab below. So this is tab 8. And so this is really to help projects think of what are all of this, what's the cost going to be to hire staff, and furnish resources, whether that's furniture, HMIS license, computer, phones, all of those things, before the project even opens. And so you may be hiring people 6 to 9 months before a tenant even moves in. And this budget is to help think through, okay, what are those costs? And so what does our onboarding look like? How much does that cost us? Do we provide it in-house? How long does that take us? Like those sorts of things. Are there operating expenses that we need to be planning for during that time period as well, during that startup time period? And then kind of those furnishing and equipment costs as well that we need to be factoring into our budget. And then regarding kind of hiring, what is the advertising, signing bonuses, background checks, bonuses, or overtime pay? So really what is it going to take to hire staff during that time period as well. And so that would then take everything that's from this budget and factor it into the budget on the service model tab that we're working on. And then that builds it out over time. And so I'm not going to go into the new Medicaid provider tab because it's a lot. But if you are thinking about and wanting to build Medicaid in the future, we've been working at a statewide level for many years to get tenancy support codes for supportive housing services into the Medicaid plan. Some helpful things to think about as you're building out your budget. First is just to know kind of generally what do services cost for us to have the number of staff that we need. So just start with the basic budget. And then also how many of your current tenants or what percentage of your future tenants do you think will be Medicaid eligible based on Michigan's eligibility requirements currently? For folks that are billing Medicaid, we know that the majority of folks aren't quite eligible. And then also thinking about kind of the impact on the financial side, and the way that your organization's finances, budgeting, reimbursement is managed. Your kind of ability to take on the kind of Medicaid expectations is also something to consider if you're not already billing Medicaid. That's more than what I wanted to say about Medicaid, but definitely just start with the basic budget, and then if you would be helpful, we can talk about more deeply about what Medicaid, how do you build that into your budget as well. Let's see. I want to make sure I covered everything. So when you complete kind of everything that is in one of the service model tabs, so 4, 5, 6, or 7, it then builds it into this budget summary tab. So you can see for the tenancy support services, that's built in here for the kind of 70 units that we identified, 70 tenants that we identified here. That would be the overall cost per tenant per year. And then it also 2B is kind of the budget at a glance, and so that it kind of builds it out overall. So you can see that again if you do each of the models, you'll see that across all 4 models as well. Okay, I know this is a lot. So we want to pause for questions. And one thing that we have heard that is helpful is for teams to look at this budget tool, play around with it, and then we are happy to sit down with you, with your team, to think about what this looks like. We've done this with a number of agencies across the state and across the country to build out what this could look like for you. And really, if you're an existing provider, kind of build this out and then compare what does it look like to what you're operating with right now, and what does it look like to try to get more aligned with kind of the budget that's generated from this. It's not to say that that's going to happen overnight, but what are some ways in which you could prioritize some of the pieces of work? All right, with that, I'm going to pause and see what questions people have. And feel free to come off mute if you have questions. Thanks, Amber. Jasmine, are there things that I missed that maybe that come to mind for you?
No, there isn't anything that I have.
Okay. Thanks. So Michelle, your question is the assumption for support coordinators that they're a licensed social worker. That is a great question. And I'm going to say that it depends. It depends on what your approach to funding the services is going to be. So if you are planning, or you currently are planning in the future to bill Medicaid, there are going to be licensure requirements. If you're not, then you may not have to have those same licensure requirements. You may want to as an agency, even if your funding doesn't require you to. But within kind of the models that we've outlined, it really varies around, are they licensed or are they not social workers? Which I know is not probably that helpful for you. A yes or no answer was probably helpful. But happy to talk through that more, because there definitely are impacts on your budget. What other questions do folks have? I think one other thing that we've learned in working with agencies as they've completed this budget is don't try to force your current staffing model into this budget. Kind of just go with the number of tenants and the service model that you're using, and if it's kind of new or existing project, and kind of go with kind of some of the recommendations that are made, and don't necessarily try to fit kind of how you are currently structured within this model. I think from our experience, it's been helpful to complete the budget overall and then come back and make a kind of adjustments as you do it, kind of complete it once as a whole and then go back and maybe factor in, this is how we're structured now. Does that work for us? What are some of the challenges and such? And then you'll notice that there's a lot of different terms throughout the budget tool and through the different models for case management, and it it varies a little bit based on the service model. But so you may see tenancy support coordinator, you may see case manager, and other terms. And so just knowing that kind of going in, that you may not see exactly what your agency has for titles, but kind of apply it as best as you can. Other questions? All right, I'm going to drop the link in the chat one more time. And as you're looking over any of the service model resources, you have questions, feel free to reach out to us. I'm going to drop, in addition to the link, I'm going to drop our email address. My computer will cooperate. Yeah, Jasmine, thank you for entering that in there. We are happy to meet with you all one-on-one, and to really go through any kind of questions that you have as you're working on the budget. Happy to, we've worked and sat down with finance teams to go through the budgets as well. And so I just dropped our Michigan team email address in there. We're sharing that. Not that Jasmine and I don't love for you or want you to contact us, but it's just our way of managing the requests that we have coming in. So just shoot us an email and we're happy to talk kind of more if you've created a draft, happy to go sit down and vote over that.